So the traditional therapy that's most often reached for if you have endometriosis or any symptoms of endometriosis is birth control. This person is kind of quite onto it. Wouldn't birth control pills make it worse? Endometriosis is a very complicated condition that involves an inflammatory condition of the pelvis, upregulation of the pelvis, a change in the microbiome of the pelvis, and a hormone abnormality. Some of these patients are actually also estrogen dominant and progesterone resistance. Sometimes a birth control pill, because it gives you more estrogen, doesn't always help. Some of people it does. Again, endometriosis is a wide range of stages. But if you look at the Cochrane database on birth control pills and painful periods, they don't actually help the pain. So there are some progestin-only birth control pills, or there's a progestin called norethindrone acetate that has traditionally been used for endometriosis. There are some newer medications that have been approved for endometriosis and fibroids. I'm going to butcher their generic names. I mean, we're usually not allowed to use their trade names when it's lecturing to doctors, so I could probably say their trade names. So Orlissa, which is Egalix, I think, it works with your brain to suppress the hormones that are stimulating ovulation. So it suppresses you, but you don't have a really, really low level of estrogen that you do with something like Lupron. So people tend to tolerate a little bit better. The second medication that is approved is Myfembree. And the way that is different is it also has the Regulix, which suppresses your ovaries by turning down the signal in the brain. But it gives you a bioidentical oral estrogen in there and a synthetic progestin, norethindrone acetate, like a combination oral contraceptive would be, but then you're also suppressing the endometriosis. So my patients who are on that and need a reprieve of the pain, sometimes you have to take that short term, and then we still work on balancing things after. But I'm not against prescription medications if they're going to help you with your symptoms. If you have an endometrioma, you do have severe endometriosis, and depending on the size of that, surgical removal may be the best option for you if you desire future fertility, and also if your pain is really bad. Usually if they're over about 5 centimeters, they don't go away, but it's something that we keep an eye on. So endometriosis is a very tricky disease, and no two people have the same symptoms. So I know that we have these protocols, but we try to treat people individually. We try to look at their gut. We also try to treat the immune upregulation as well. So I hope that helped.